My 94-year-old mother has dementia and COVID and is in a memory care center. This is an update. First things first, Mom is recovering from COVID. I spoke with her earlier, thanks to one of the magnificent caregivers where she is, and she said, here's your mom, talk to her. Yesterday, I couldn't talk to Mom because she had laryngitis. She was coughing so much. I was really concerned about her yesterday. Today, it's like she's over the hump and doing well. I told Mom, I said, Mom, please ask some of the staff to let you get out of your room and walk up and down the hall so you can get some exercise. It's not healthy for you to be cooped up in the room in bed. So will you promise me that you will get up and walk? And she says, yeah, I promise. And she goes, what did I have? And I go, well, you've got COVID. This is your second time. You had it 2 years ago and it was bad. This time it's not as bad, but everybody's concerned about you. Here's a picture of her walking down the hall. The sweet caregiver just sent that to me. I'm having my lunch as I'm giving you an update. I have my tuna salad from yesterday that I'm eating with crackers today. Mom is doing better. She's recovering. But I wanted to say something to all of you people who have said, I would never put my mother or father or loved one in a memory care. I would never do that. I would never do that. Let me explain something to you. Mom lived with me for 8 months. She didn't trust me dispensing her medication. She didn't trust me as far as my house being safe. She didn't trust me because I'm her daughter and I'm not a medical professional. She did not trust anything that I did. She was not happy at my house. We, hospice, Mom, her Medicaid caseworker, we all worked effortlessly to find Mom a good memory care facility. She's in one now. When I talked to her today, I got choked up because I said, Mom, yes, you have COVID, but you're in the best place. You've got a handful of staff and nurses at your beck and call. You can push that button anytime. She goes, yeah, I know. And I go, well, don't you feel good there? And she goes, yeah, I really do. My point is, some people with dementia have a lot of irrational fears, Every dementia patient has different things that go on inside. They don't all act the same. And it can change from day to day. Mom was so uncomfortable here. She had a lot of fear. And like I said, dementia people, a lot of them will have some irrational fears. Mom has been there since April the 3rd, I believe. She is so comfortable. She doesn't have that fear anymore. It's a lockdown facility, and she knows that. She doesn't know it's a memory care facility. She just thinks it's a skilled nursing facility. That's what we're going to let her know. When she asks me what kind of place it is, and I go, well, Mom, it's a place where people who have had brain injuries, if we mention the dementia word to Mom, she goes crazy. Mom did have a brain injury in March of 2024. It was fall of 2023 that she had COVID. Her dementia declined. And then April or March of 2024, brain injury, subdural hematoma, and her dementia declined. So she's happy there. I could tell in her voice she feels safe. This is probably the first time in, I can't remember when, I have felt my mom's happiness. She knows she's being properly taken care of and she feels safe. So those of you who have a loved one, if they have fears like that, irrational fears or behaviors, and you just don't know if you can handle it, check into some memory care facilities. This is one of the best things that have ever happened to my mom. I can call there and talk to her anytime I want to. I go to visit her at least once every week, sometimes twice. But I am at so much peace knowing that my mom is safe and she feels safe, and that's really important. Finally, quick update on my health, and today was my post surgery doctor's appointment, and I go back in 3 weeks. I'm wrapped up like a Christmas present. I can barely move, but I can't lift my arms over my shoulders because I had some benign lumps removed underneath my armpits, and I had my right breast reconstructed from cancer surgery. So I'm doing well. I'm tired a lot, but not as much as Mom. I've just got to take it easy. I've I bowed out of my upcoming radio show Saturday because the CD players that I have to use, they're stacked way high and I have to reach up. So someone else is going to cover for me, but I'm doing well. Mom's doing well. Memory care centers are not bad. It's the greatest thing that ever happened to my mom. I'll check in again later. Don't say anything about this shirt because yes, it's the same shirt I've had on for years and years.